Hello, I'm Keely Milton from Laura Middle School, here at WBOC's Historic Studio D. You're watching Don't Marvel Life.
And just real quick, I want to say it again. Thank you to the Laurel Middle School, the other half of the journalism class coming in today. It's great having you guys here today. So here's a question for you. Are you sitting down? I don't mean that in the way you may be taking it. Really, are you sitting down? Whether you're on your couch, at your desk, did you know that the simple act of sitting can actually put physical pressure on your spine?
That's right. In fact, researchers say sitting distorts the natural curve of the spine, and doing it too long can lead to everything from pinched nerves to herniated discs. Here are a few tips to correct your posture to prevent some pain. 20 minutes, that's all it takes for blood to pool into your legs and pressure to build in the spine. It's one of the reasons why researchers say sitting is one of the worst positions for the body to maintain. But how we sit could be just as big a problem. One New York researcher found your body can only handle 20 minutes of slouching before it starts to deform your ligaments. So when it comes to good posture, remember the rule of 3. Sit with your neck forward. Your upper back should curve out and lower back should curve in. Also, your shoulders should be relaxed. To give your body a break, stand every 20 minutes. One Stanford researcher says simple stretches such as twisting and turning your head once every hour helps relieve more tension than yoga once a week. And posture is also the key to better health. Studies show posture affects every bodily function from breathing to hormonal production.
Gotta watch out for that stuff. So now that you know the steps to proper posture, you can try to prevent some pain. But if you're already dealing with a little back discomfort, you're gonna want to address it instead of ignoring it.
Joining us today to tell us more are Doctors John Rees and Trip Del Campo with First State Health and Wellness in Rehoboth Beach and Milton. And Dr. Rees, in addition to sitting at the office or at home, I know I have found this out to be true, driving can be really hard on your back.
Yeah, it's significantly actually more of a problem than sitting at a desk because you have the vibration from the car and the bumps in the road that cause additional problems. What I've told patients for years is when you're taking a long drive, every hour at least, take a mini break. And it can be as short as getting out of the car, walking around it one time and getting right back in and go. But just something to break that postural stress is extremely important.
I'll admit I don't do that. I guess I need to start.
You just want to drive through.
Just keep going. But another thing that I do, I mean, I've had the occasional back discomfort, a little back pain. I thought my belt's too tight or something. Instead of denying it, we really need to address it, don't we?
Yes, the main reason for that is most of the time low back pain is of fairly conservative nature and is mechanical in origin. But there's also significant serious health conditions that can also cause low back pain. There's cancer, infection, kidney and colon disease can cause it, and osteoporosis.
So you want to address it right away. Now, Dr. Del Campo, oftentimes, or you suggest that people who do have back pain address it with a chiropractor. What are the advantages to that?
Well, by far and away, most patients seek chiropractic care to get out of pain. In addition to pain relief, there's also increasing range of motion. Life's no fun when you can't bend over to tie your shoe or play around a golf or chase after your kids or grandchildren. Those buggers are little balls of energy, and if you're not at 100%, it's going to be hard to keep up with them. But that's not in addition to that, it's not invasive like as spinal surgery would be, and studies have shown that it's also as or more cost effective than other interventions like physical therapy or that spinal surgery. As well, and there's a low risk of side effects.
Because obviously you want to address the pain rather than taking pills and drugs and everything to cover it up.
Correct. It's like taking the batteries out of a smoke alarm. Taking the medications and things like that. Yes, it's helping with pain, but it's not really doing anything to fix the problem. So chiropractic and other interventions like that will help fix the problem instead of just covering it up.
Okay, let's talk low back pain for a second. And I came in and talked to you, and you say, okay, let's do chiropractic treatment. What does that consist of?
Well, we have a bunch of different tools in the tool belt. In addition to the adjustment, which is what most people think of when they think of a chiropractor, there's also other interventions to help address both the soft tissue, things like muscles and ligaments, as well as the joint component of pain or your symptom. Things like massage, things like acupuncture, spinal decompression, which is like a traction to help lengthen the spine. as well as low-level light therapy, laser light therapy. And a big component of our treatment is incorporating active rehab, exercises, stretches, things you can do at our office, things you can do at home. That's very important, as well as to keeping the pain and the symptoms coming back time after time. And that's what we see a lot is the repetitive things. If you're not doing the active rehab, the pain will come back.
It'll come back.
And Dr. Rees, now, back pain, oftentimes, it's inflammation that we can have in our back, and inflammation can be the result of a number of things. Tell us about that.
Well, inflammation very often is based on how we eat and what we eat. So diets that are too reliant on refined grains and fast food, the things that tend to cause people to be overweight, the actual foods that result in that also result in inflammation going up. So even long before people lose the weight, just when they start eating in a way to lose weight, the inflammation begins to go down and pain goes down as well. And inflammation is extraordinarily important for reasons other than pain. You can actually look at it as a smoke alarm, but the damage it does in other ways is much, much more serious and of a problem and needs to be addressed.
Okay, Dr. Del Campo, we start treatment. How long is it going to take?
Well, there's no one-size-fits-all treatment. It depends on a variety of factors, things like age, pre-existing problems, including things like obesity or diabetes, stuff like that. But generally, we start out with multiple visits over the course of a week, and then as your symptoms progress or as your symptoms improve, the amount of treatment decreases. And then once we get you out of pain, we work on really fixing the problem, correcting the muscle imbalances, stretching tight muscles, strengthening weak muscles, and that can take a period of months, and then over time, as you're doing it at home, years till you're fully functional and 100%.
A lot of good information, Dr. Del Campo, Dr. Rees, thank you so much. Still ahead on Delmarva Life, when a loved one passes, there are so many uncertainties and so many questions.
And some of the most commonly asked questions will be answered next.